Maybe I quickly use this to thank you all for your great participation, and also people on the webcast. But I think we had a very rich day today, and if I may recap a little bit the big lines of our discussions today, we kicked off the day with Andy, who was presenting us how the future of planetary health will depend on cities. And then we deep dived in the determinants of urban health with David, explaining how cities have characteristics that are positive or negative with regards to urban health, and on which we can act. Where Anna then brought the idea that we have to introduce the tools of systems thinking, as cities are real ecosystems with different elements to be considered than we currently do. Then in the second panel, we discussed on what the impact of urban planning is on health of populations there. And we heard from Mark of the different health impact assessments of aspects of urban planning, and wonderful examples of that in different cities. But also from Jeannie on how you need to engage the interest of the citizens and the communities themselves, and have local ownership is the key to success with good local governance, obviously. And Remy completed that by saying we really need to bring people together from the health and the urban planning sector, because we don't speak the same language necessarily, and we need to build common goals so that we leave no one and no space behind, I believe. In the third panel, we learned from David that there's really an evidence gap on why only half of the diabetics get controlled in the end. And in fact, the vulnerability assessment is delivering very surprising results, that some groups in the populations in the cities you work with, cities changing diabetes, are absolutely not the ones we would have suspected first to have the most risk. Karen from Kaiser Permanente gave us these wonderful examples of your work, and how in the US you identified in each of the areas, you identified the same 3 social needs of your members on housing, financial strain, and food insecurity, so that you now even integrated that in your medical record. And I think it's very impressive that an insurance company, if we may say it like that, or an insurance organization is addressing the housing needs of population, because that's your first priority now. And then we heard from my team colleague, Jeffrey So, how Better Hearts, Better Cities, in a multi-sector partnership for addressing cardiovascular urban health, was successful in improving health outcomes thanks to this drive with local ownership to improve quality, to use real-time data for decision-making, and influence health policy with the evidence generated, but also really leveraging the fact that we could bring health and care closer to where people live was very instrumental in the success. Then in the next panel, we looked at the effect of agriculture, food, and transportations on urban health, and learned from William that the global syndemic of obesity, undernutrition, and climate change is introducing a real new sense of urgency, because we really have to act upon that. And one of the main things we can start acting upon is that processed food is the main driver behind that global syndemic. So let's see how we can address that also in low-income settings. Then Alison gave us the example of the AB InBev Safe Driving Initiative with surprising results, both positive and less positive, but with good learnings to redesign it to a 2.0 model. And then we heard from Olga on all of these innovative transportation models in Latin America, which are very impressive and very useful for other areas in the world, I am sure. And lastly, we had this wonderful panel here next to me on how data, digital, and AI influence the way we look at how people age, how we give them a better quality of life while they age, how cities can warn their citizens on dangerous things like bad air quality, and how in low and middle income countries AI has a real promise of increasing access and equity to health and care, to increasing quality, to increasing efficiency and decreasing the cost of healthcare, but also still has a lot of challenges that we have not enough reliable data available digital. We have these equity issues that can be exacerbated by introducing AI, and we have still only very nascent policy and regulatory environments. So these challenges are very, very important still, but we have these fantastic opportunity that we have to rethink the way we are going to think about urban health. I think it's time to reimagine urban health. And thanks again for all of your participation. So with that, I would love to invite you to drinks, I think, here outside. Joe, maybe you
No, just to say, I think one other takeaway. First of all, a hand for Anne for the fabulous summary. I think that deserves an applause. I think those of you that are here, members of the forum and speakers, are invited to dinner, which is plunged in your program, but we do have a public reception. Everyone is here as welcome right outside when we adjourn. And I think one of the really interesting things for the overall forum is we've heard about this fourth P today, PPP, maybe public-private partnerships with people. It becomes an increasing factor, really, in sustainability and sort of creating these sort of initiatives. So thank everyone for fabulous involvement. Tomorrow morning, you've had a preview of coming attractions with Charlotte's comments during today, but tomorrow morning we're going to hear from CEOs who talk about why did I get into this in the first place and what are the pressures inside my organizations to stay with this urban health agenda or to move away from it. And similarly from two mayors, elected officials, who are going to tell us why they picked health and what the upside and downside is from the political perspective. So we're looking forward to pulling that all together with what we've talked about today in the morning. So you're welcome back at 9 a.m. And in the meantime, those of you that are here, please join us for the reception. And those of you that tuned in, see you tomorrow. Thanks.
Thank you.